Welcome to Healthy Solutions, and this is our educational segment. We want to be looking at some words. I want to be looking at colonics, laxatives, and cathartics. First of all, let us look at colonics. What really is colonics? And the other word is colon hydrotherapy. Colon hydrotherapy. Colon water therapy. Colonics irrigate the entire colon with water, whereas laxatives or cathartics are oral medications, that softens the stool and stimulates the colon or the bowel for bowel movement. You understand? And this is for temporary relief of constipation. Laxatives mainly affects the lower section of the colon and can become dependent. You can become dependent on laxatives. In other words, you can become addictive to laxatives. And I know there are many persons out there who can identify with what I'm saying. They're addicted to laxatives. They can't go unless they take some sort of laxative. And that's dangerous. That's very dangerous. As a matter of fact, the laxative movement, is a serious business, over the years. And as I said before, laxatives and cathartics, the cathartics are strong agents like senna, magnesium citrate, castor oil, etc. And this is big business, which isn't any surprise given the prevalence of constipation. There's a lot of people that are suffering from constipation and living in denial. They'll tell you, oh, I'm not constipated, but yet it has been 2, 3, 4, sometimes weeks that some persons have not defecated. They have not gone to the bathroom. Yes, my friend. These products usually results in the injection of debris from the bowel because the colon becomes so irritated in expelling the offending laxative that anything else that is loose goes out with it. I've found out over the years that the use of laxatives and cathartics is not only habit forming or addictive, but, decidedly destructive to the membrane of the intestine, the soft tissues, the walls of the intestines. And when we talk about intestines, you must realize that you have the small intestine and you have the large intestine, but we refer to the large intestine as the colon. Laxatives and cathartics disturb the normal rhythm of the excretory organs, which sooner or later, starts to rebel. That's why so many people start with mild laxatives and soon graduate to cathartics. In other words, to stronger stuff, because after a while, those mild laxatives is no longer effective. It's not working. Just like with drugs, it is said. I've never experienced it, don't intend to. It is said that, a drug dealer will give a person when they want to hook them, they'll give away a little pinch of cocaine, just enough to give them that rush, to give them that high, that feel good, oh my God. And then they want more, and they want more, and they want more. So it is with these laxatives and cathartics. You understand? So after a while, the body gets so used to it that they have to go to stronger stuff, and then sooner or later, nothing is helping. You understand? So you would say they graduate to stronger stuff, and then they get to that point, the point of no return. So they cannot use the bathroom, naturally. They have to take something. Maybe some of you listening to me right now know what I'm talking about. Maybe you know someone that this has happened to or is happening to. A co-worker, a family member, a child, a good friend. You understand? But I want you to know, guys, nothing beats natural, warm, filtered water, which is used in colonics, and also the great benefits of water to the body. You know, a healthy colon. You know, all of us will go through a season in life where we'll have different kinds of ailments. You know, if it's not one thing, it's the next. But I'm telling you, your colon plays a vital role in health and in healthy living. And it's a lifetime commitment, you know. It is not something you do once in a blue moon. It is something that you make up in your mind that you're going to do. Because it is said that your colon is your second brain. And if you was to look at the colon, how it is all squished up, and if you was to see the brain, you would say, my God, these two resemble. You understand? So the colon is really that extension of your brain. And so by now, many of you that would have come to Healthy Solutions or come to me would have learned how vitally important it is to keep the colon clean and, you know, washed out or flushed out periodically. You understand? You know, especially if you're having constipation, you're suffering from some sort of constipation. Let me say something. A person could be going religiously also, and there is still impacted feces in the rugae, or what we would say little grooves, little pockets of the colon. You understand? And it's just stuck there. It is just stuck there. You understand? Have you ever gone to the bathroom and you defecate, you pass, you know, you pass out your stool, you doo-doo or whatever, and you just know that something else is there, and you're pushing and you're straining and you're bearing down, but it's not moving. Have that ever happened to you? You know, leave me a comment in the comments area. One of the things that I try to do is to educate people, men and women, about, you know, healthy living and healthy lifestyles. And you got to understand, this is nothing to be ashamed of. This is just another healthy regime. This is nothing to be ashamed about. You know, one time there was this, you know, myth or, you know, this stigma that you couldn't talk about these kind of things. No, this is something you want to be talking about. This is something you want to be sharing with your friends, family members, co-workers. You understand? This is something because all of us, notice I didn't say all of you. I say all of us have gone through or still going through some sort of constipation, sometime or the other. All right? So you would have learned a lot from me, the importance of, you know, caring for your colon. It is also important, guys, to understand the mysterious and miraculous manner by which certain areas of the colon are both directly and indirectly related to the various organs and glands throughout the anatomy, throughout your body. And many of you would have seen the charts that I would have shown you about the nervous system, about the circulatory system, digestive system, and all of those things. One of the things when you do come to Healthy Solutions, you're not going to leave the way you came. You know, your mindset is going to be changed. Your mindset is going to be empowered and educated. And your mindset is going to be renewed when it comes to the colon, when it comes to your entire body, when it comes to your health and healthy lifestyles. When there's a disturbance in any particular area of the colon, you can tell which part of the anatomy is afflicted or likely to be afflicted. The colon is intimately related to every cell, every organ, every tissue in the body. As I always like to say, every part of you, every part of us is connected to the colon. Every part of us is locked in to the colon via the nerves and the cells, blood vessels. Everything is locked into the colon. Gallbladder, liver, stomach, lungs, reproductive organs, male reproductive organs, female reproductive organs, your breast, eyes, ears, from the very tip of your finger to the sole of your feet. Every part of you is locked in to the colon. All right? So regularity of the bowel should start at birth and continues until an autopsy, that's when you're dead, indicates to what extent you have cared for or neglected the colon. So, from a baby born, a little bit after that, we want to see that baby pass stool. And, being a nurse for over 20 odd years, we have to monitor and see that the baby pass stool. And, and then that is recorded. We call it the plug. You understand? And that's recorded. You understand? So, generally, guys, a normal baby's colon is perfect, at least for a while. Progressive degeneration of the colon begins shortly after birth. Well, once milk and, once, stuff starts to come into the stomach and come into the small intestine, and then, this is where now we have, the waste come out, So here you see that generally at first, everything is all right. But then a little bit after that, from childhood through adolescence, discipline or lack of discipline is generally responsible for the colon's condition. Thereafter, knowledge and free will determine the state of the colon and its effect on physical. I want you to hear me out. Let me say that again. As you grow, as we get older, our knowledge is increased, or should increase, and we have a free will to determine how we care for ourselves, how we care for the colon. You understand? And so you got to understand that the colon affects us physically, mentally. It also affects our spiritual health. Somebody may be saying, how it affecting your spiritual health? Well, if you're constantly constipated and having pain and you even going to church and you know within yourself that something not right, you might not be saying it, because of the stigma and because of what we have been taught over the years, and the embarrassment. You might think that it's a shame to talk about it, but if you're around me, we're going to talk about it. We're going to talk about it. And that's why I'm doing this right now, because I want you to start talking about it. I want you to understand. You understand when you come to Healthy Solutions, and you come in and you book your appointment and you come in to see me, I'm going to find out more about you. Is there anything that I should know? Because really and truly, this is not something that a person can just go on YouTube and Google and just start doing. You got to be careful. Make sure that whoever is doing this type of thing to you, that they are well trained and equipped and knowledgeable about anatomy and physiology, have some sort of medical, knowledge also, because it's not everybody's a candidate for colon hydrotherapy. You understand? If someone is going through certain things, and I find out that that's what they're suffering with, and what have you, I will cancel that appointment until you can bring me a release from your medical doctor or something like that. So this is one of the good things about Healthy Solutions. We're going to make sure, I am going to make sure that you're going to fill out that consultation form, and you're going to sign that form. Because at the end of the day, this is what you said, this is what you put on the form, and this is you saying it. So if you want to lie about your own condition, your own health, and don't tell the truth and risk your own, self or life, then, that's what it's about. But I'm very professional, very serious about, these kind of things. And I give God thanks for that. I really give God thanks for that. So, an impacted colon can affect you physically, mentally, spiritually, and as a matter of fact, can affect you right into having to, have your a part of your intestine dissected or, removed. You understand, and end up with a colostomy bag. Some of you would know friends or relatives, with a little colostomy bag. It's very embarrassing, but sometimes in life it does happen. Cancer or other things can be going on, congenital diseases and, birth defects and all of those kind of things can cause a person to end up with a colostomy bag. So it's not just about, constipation, but that can also lead to it. So don't be deceived. You see how we look and feel on the outside, be it your skin, your nails, your hair, even your mood, the aging process. All of these things depends on what's happening on the inside. You understand? Have you ever seen a person, even I can refer to myself, and what better way, what better example, from time to time, even just recently, persons will say, well, how old are you, Dr. Fagan, or whatever. I'll give them my age, way up there in the 60 odd, you understand, 60 odd, high up plus, and they'll say, they'll pause and draw back and, can't believe it. Look at your skin. Look at your skin. Look at your nails. My nails, I don't need to be using an acrylic and a nail hardeners, anything like that. My hair still grows. It is still healthy and all of those things. So, whatever is happening on the inside will reflect on the outside. There are persons that I see that could be my son or daughter, even my grandchild, and they're aging. They look so old, and a lot of it has to do with what's going on the inside. So learn this. Colon hydrotherapy, doing colonics, is not something that just about defecation or just about constipation. You're really helping your entire body. You're helping your entire system. You're helping the aging process. You're helping your mind. You're helping all of your organs. And what a better way to rehydrate your body. Rehydrate your body for 30 minutes or, a minimum of 30 minutes. You understand? Remember, the colon is divided into 3 sections. The ascending colon, which begins on your right side in the groin area. And then you have your transverse colon that, dips, That transverse colon is what we would say the waistline colon. And then you have your descending colon. And then you have a little hump there, a little S shape like that would look like under your sink, your face basin or kitchen sink, and that's the sigmoid colon. That's now the ending part of the colon, and then you go into the rectum, and then into the rectum and the anus, and that's the storage area. That's the storage, and that's where sometimes a lot of the constipation take place also, because dehydration. People are not drinking enough water. They're not drinking enough water. They're drinking all the Pepsi. They're drinking all the Coca-Cola. They're drinking all the other stuff. But they are not drinking. You are not drinking enough water to naturally soften up your stool. You're not having the fiber. And so there's a lot of people who tell you, oh, I don't like green leaf stuff. I don't like lettuce. I don't like this. And I don't like green juice. And I don't like that. And that is some of the reasons why because they're not getting the fiber. You understand? To help make that bulk and to make that bolus in the stomach and, to get all this stuff moving. You understand? A lot of people is not chewing their food properly. You understand? They just put it in the mouth, gulp it down, and these big old chunks has to be then assimilated and digested in the stomach and then goes to the small intestine. And, a lot of people is not benefiting from even what they're eating. So I just had to share this with you, that you understand that caring for your colon is a good thing. It's a very good thing. And I can say that when persons come in, even if it's their first time, they're ready and want to do a second one. They want to do a second. After all, it's beneficial. It's just water. It's just a little tube right there in the rectum, just a little tube. And, we inject, warm filtered water, and we fill and we empty, what we would say the pulling stage, and we fill and we empty, and then you go to the bathroom. And that's where, all the magic goes, what didn't come through the tubing and goes straight to the sewage, then is completed in the bathroom and the toilet. And sometimes if a person is real clogged, or there is stuff there that is stubborn and hard, we might have to refer them to get something else to help soften up, like how they have just completed the session. And, soon after that, people begin to have, bowel movement. They have to be saying to themselves, look at this, all of this was still left in me. You understand? So looking forward to seeing all of you. And if you have never been to Healthy Solutions before, I'm sure that, you would want to come and visit us. Don't forget, there is one WhatsApp number, 1-877-783-2378. Let me say that again, 1-877-783-2378, because remember now, I am between home. My home is in Cayman, and between home and Jamaica. So I just used the one WhatsApp number. And I don't do walk-ins at all. I don't do walk-ins. It's strictly appointments. So if you just want to get in touch with me, or you'd like to make an appointment, or you'd like to know when I'll be back, get in touch with me, and I'd be more than happy to, help you if I can. And leave me a comment. Leave me a comment. If you're on Facebook or YouTube, I'd appreciate it if you would leave me a comment. If this has been educational to you, if you have been to Healthy Solutions, nothing to be ashamed about, leave a comment. Let someone know how beneficial it has been to you, how good you feel, and, just encourage somebody else. I'd really appreciate it. Thank you. Thank you very much.